Today, right now, Sigal is numbing our lovely model, Anita, and we're just using a 5% lidocaine solution. Typically, when we're doing microneedling, we do not use any kind of compounds because a lot of the compounds are vasoconstrictive, and we do need to have some type of pinpoint bleeding. Just to give you a little history on the eDermaStamp, the eDermaStamp is made by Dermaroller out of Germany. Dermaroller, you hear this as a common name all over the place. It is actually the company name that unfortunately they didn't have globally trademarked, and so a lot of companies use that. But Dermaroller started working with microneedling in Germany in the 1990s. And what they were doing is they were working out of a hospital with burn victims, and they were trying to really constitute scar tissue into collagen type 1, which is the mesh type collagen. Back in the day, in order to do any kind of scar revision, they were typically doing more ablative treatment, erbium and all different types of lasers, and they didn't want to create scar tissue over scar tissue. So what they discovered is if you're using an atraumatic wound over a scar tissue, and atraumatic meaning non-trauma, if you break down the scar, but in a manner that the body doesn't have to reproduce more scar tissue, you can actually reconstitute it into collagen type 1, which is the mesh type collagen that gives us elasticity. I always say collagen type 1 is like material, and if you cut the material and you stitch it up, that's collagen 2 and 3 or scar tissue. So we are going to use a low bacterial load type of hyaluronic acid on the skin to do our treatments. I'll get back into the history a little bit. I just wanted to show the device as Sigal starts it. When we're doing the treatment, we have a face map that we give our clients, and they start typically on the forehead because it's very thin tissue at about 0.3 millimeter, and they work up in increments of 0.1 until they get pinpoint bleeding. Pinpoint bleeding can take place anywhere from the 0.3 on the forehead to 0.5. I've even had people at 0.6 and 7 start pinpoint bleeding. Pinpoint bleeding literally looks like a red pore because these are atraumatic needles. They do not produce a significant amount of blood because they don't pull and tear the skin. And so what we're looking at, you can't really see from the camera very much. Can you see that? You probably have to go up a little bit in increment.
No, I can see the pinpoint bleeding.
Yes. The camera has a hard time to see that.
But there is pinpoint bleeding.
But it just literally looks like a red pore. It'll show more the more treatment that we as we progress. So what they were doing is called an atraumatic wound. And an atraumatic wound, if you can think of like a microscopic paper cut. A paper cut can be very deep, and yet when you're looking for it, it doesn't show because it's sort of the perfect wound and the skin collapses on itself. And typically after that, you don't have a scar. It's the same thing except microscopically almost. Our needles are ground to 360 degrees into almost an infinite point. And you see that we have a cord. We have a cord on purpose because the only way you're going to clear tissue properly is if you have electrical output, because this is going at 150 insertions per second. There's a lot of battery operated cluster tip pens out there, and unfortunately they just don't have the same speed as something that is electronic. And cluster tips create a lot of pressure on the tissue, and the more needles you have, the more it sort of compresses the tissue. So on our tips, they did a lot of studies and a lot of different configurations, and we only have 6 needles on our tip, so it enters the tissue very accurately. Some people might say, well, if you only have 6 needles, how is that good coverage? The reality is at 150 insertions per second, really, who cares how many? It's so incredibly fast, you're still going to get good coverage regardless. So what happens is when you're doing an atraumatic wound, most of the blood you see in, again, a cluster tip that's pulling and causing drag or creates what's called microfissures. What we're trying to do is just create almost like microscopic insertions, which would break down the any kind of scar or atypical type of tissue, but it does not require the body to go into an emergency mode. The body recognizes in your T killer cells and all your protection of your tissue, your immune system goes on high alert because it knows it's been compromised. But basically, it's just like, wait a second, there is no need to go into emergency because I don't have to create scar tissue because the tissue is closed. So what it does, it starts to go hard at work creating collagen-like type 1 to thicken the tissue rather than going into emergency mode and start causing micro scars everywhere. So it's not just about what inducing collagen, it's what kind of collagen you want to induce. There is 28 different types of collagen and about 7 that relates to tissue. And we're very specific when we're creating collagen that we only want to create collagen 1. We do not want to create collagen 2 and 3, which is parallel bar formation collagen. So if you actually took a biopsy on the types of wounds we're making, it's significantly different than you would with a lot of the compression tissue damage that you'd see with other microneedling pens. That being said, our device is a medical grade product. It is created in Germany, and we have a very specific ISO and CE. So all of our products, you'll see a lot of products and they say we're sterile, and if they don't have the appropriate manufacturing certification, how do you know it's sterile? So all of our products are actually audited for sterility and defect. So we have to apply to the government. It costs a lot of detail and a lot of expense to go through this, but basically they can come in and take pallets of our product at any given time and check them for sterility. Most of the products out there, God knows if they were manufactured in a right way. There's a lot of products, especially with microneedling, that they sell and they're made in China. You can get them on Amazon. They are not a medical grade product. They're going to cause microfissures on the tissue, which in turn is going to cause other kind of skin ailments. What she is applying right now is a low bacterial load hyaluronic acid, and it's in a syringe. It is very important that you're using a medical grade product. You cannot use something that's air pumped or some kind of cosmetic product when you're doing microneedling, because our hyaluronic acid, for instance, it's in a syringe. There's no preservatives in it. There's no fragrance in it. When you're using microneedling, it's very important what you're administering into the tissue, because you can end up causing all kinds of effects, which almost in the future could look like dermatitis. When we're doing microneedling, one of the biggest benefits is the fact that we are engaging the immune system, and it's going to go on high alert, and it's going to start correcting, and our cytokine levels are increasing. Cytokines are the cell messengers of this. We're very particular when we're using any kind of product on the skin. We're using syringed hyaluronic acid. One of the other products that I would like to mention right now that we use on our tissue is a sterile product, and it's called Ready Medical. Ready Medical, we have 4 different types of treatments that you can provide for the client. The one that I probably use the most and I'm totally in love with is a product with growth factors. It has 8 different growth factors in it. And why do I, there it is right there. It's a beautiful thing. Why I like it is because as we age, a lot of our fibroblasts have already converted to fibrocytes. So when we're even doing microneedling or RF microneedling or any of these other treatments, because our fibroblasts have gone dormant, we are not going to produce the same amount of growth factors to create all these wonderful biochemical reactions that we're looking for. So by using the growth factor with the Ready Medical growth factor with 8 growth factors, we're basically fooling Mother Nature. We're actually adding growth factors to the tissue, so your skin's going to have the response it needs, and it's going to encourage the fibroblasts, or at least continue and maintain the fibroblasts that are already active. So it's really super. Another thing you have to worry about when you're doing microneedling is using sterile product, as I mentioned. But not just using sterile product, using other foreign ingredients. There's a lot of products out there, when I'm doing something, even with hair growth or even with our pigment treatments, even though they're low bacterial load, I'm going very shallow when you're administering anything but hyaluronic acid or anything but saline solution. You can do saline solution because it's sterile. Unfortunately, because the skin's been so perforated and you're using saline, that usually their skin will get really dehydrated after. So it's you can do it, but it's probably not the best. Sterile hyaluron is.
Katie, Sigal is doing now the ready medical. If you can.
Yeah, I already talked. I will in a second.
Okay.
So it's very important to make sure, or else if you administer something that's foreign too deep in the tissue, you're going to end up with a dermatitis type of response, and that happens sometimes weeks after a treatment. So here's the Ready Medical that I spoke of with 8 growth factors. The product itself, it uses a sonicated hyaluronic acid. So after the hyaluron has been mixed, it is treated to break down the molecular structure of the hyaluron, so it has different variety of sizes of molecules in it. And on the other side, we have our growth factors. Now we're only going to blend it a few times, or else it gets too thick. So I think that's enough. Typically, the more you blend hyaluron, the more jelly it becomes. So we normally just pump it back and forth a few times and then apply it onto the tissue. This again is a sterile product. You can use it even in microneedling if you wish. We used our regular syringe, but you can use this for microneedling as well during the treatment because it is a sterile product. And we just apply the syringe like that. We're going to blend it into the tissue and then we're going to mask it in. So you can use it as a layering product like this because the skin's been so perforated, it's going to absorb really nicely, specifically if they're dry to begin with. You can actually, especially with the COVID, you can actually sell this particular product and send it home with your clients for instructions, and they can buy home rollers and not anything more than a 0.2 because we don't sell professional rollers for people to use at home. That's another story altogether. But they can buy the home roller at 0.2 and roll their skin and apply their Ready Medical at home, and you can sell this as a retail product as well. Our Ready Medical also comes in a vitamin C Ready Medical, which is a really strong antioxidant. So you could have applied the Ready Medical with vitamin C, would have been a nice treatment for her, and that's going to help with hyper-pigmentation. It's also very strong, has a high ORAC score, so it's a very strong antioxidant. We also have the repair and healing. The repair and healing Ready Medical is a wonderful product that you would use after like tattoo removal or after something that is more significant type of wound. And what the repair and healing Ready Medical does, it almost has like a steroid effect to the skin without using a steroid. So if someone was really going to over-respond to something, you can put the Ready Medical repair and healing on the tissue, and it is really going to reduce inflammation and irritation. It also promotes non-scarring wound healing, and it improves our immune response in the tissue, and it repairs damaged protein. So the product that is in it is what they call PFD and PA. It is the pyrofluorocdaclyn and Bacillus angulata. One is an extract which really helps with anti-inflammatory, and it's antibacterial as well.
Katie, just before Sigal applies the mask, can you see in the camera how beautiful and red the skin is? You see the redness in the camera, or?
Yes, yeah, we can see it. And normally I just stop my foot switch. There's a foot switch on the handpiece on the machine as well, so you can stop and go the machine without ever having to compromise and go back to machine, because we are working with blood. We're always trying to keep the area as safe as possible. So I just turn the foot switch off, and if she does secrete any kind of keratinized plasma, I just work it in with my regular hyaluron. I don't let it sit there, and I don't wipe it off with cloth either. I just blend it in with my hyaluron and make it part of my product because there's growth factors in it. I'm going to use that. Right now, we're applying our recovery mask, and what this does is it sort of keeps the skin in a air-free environment. That particular mask is almost miraculous. It's so soothing. It has matrixyl and hyaluronic acid and a little bit of vitamin E in it. And it just keeps the skin barrier protected for that 20 minutes in clinic. And if there was any blood from any of the treatments that we're trying to provide, again, I would blend it. I would just mask right over it. And all of that secretion is just going to reabsorb back into the skin. And it's going to work just like product. Because again, you have your natural growth factors happening there. And typically when you remove the mask in 20 minutes, the redness has reduced by probably 70 to even sometimes 80%. It really makes a huge difference on the recovery of the tissue if you mask properly. A lot of times, after microneedling.
Shall we say?
Yes. So there's lots of juice left in the mask too. I'm often I see a question here I'm going to answer in a minute. I'm often syringing it back into the syringe and just let her take the rest of the juice home for home care because there's a little cap with that syringe. This is a medical product, and you can see the label here. We often pull that off and stick it on. If there was ever a recall on our product, they'll want to know that number. So that's what Sigal is showing right now. But going back, it's very important not to be just putting anything on the skin. You do not put on a sunscreen afterwards because there's just too many, even a natural sunscreen still has too much different ingredients in it and too much chemical in it. So for 48 hours after, we're just doing hyaluron. And then you can work into your other aftercare, and we have very specific aftercare for needled and compromised skin. We have the Acceleris line of product that's developed by Dermaroller to enhance the results of the needling, and we have the classic Dermaroller product as well. And yes, we throw the needle cartridge into the box there for discard.
The hard container, the sharp container.
Yeah, everybody does that. So anyway, we have a very specific product protocol afterwards, but a lot of times people still like to buy the mask to take home because it's so soothing and they've experienced it in clinic. And a lot of clinics and doctors use that for that particular mask for after any kind of microablative RF needling, Fraxel, all those kind of treatments where they use the mask on after those kind of treatments to protect the skin, allow the skin to heal and to keep that hydration going. So very, very nice treatment.